Markus Messerli is the owner and managing director of a pharmacy in Bar. He studied and completed his doctorate at the University of Basel, where he also has a lectureship. He is the president of the Pharmaceutical Care Network Switzerland. Thank you so much.
Thank you for the kind introduction. Actually, being flexible is part of my job because I don't know every time I start my day in a pharmacy, I don't know what happens. So actually, it is a everyday situation for me. I'm looking forward for the presentation from Mr. Dillon because we got inspired by this group. We had it's not our idea to screen in pharmacies. It was not our idea, but we were inspired by him because he can show it's not just only we sell the products normally, and they're very expensive in this case. And getting involved in the screening process, that was a really huge motivation also to ensure that we can not only sell a product, but screen, detect, start, and finish a therapy. That's a motivation for us as health professionals as well. So I'm going through our training program because that's what actually was the main work. We trained pharmacists to do the screening. It's not a big thing, but still it's a topic where you like to be prepared for the discussion with the clients, to how to approach, how to discuss, individualize, and having good strategies to get them screened. So this was our idea. We were not telling the pharmacies which patient at risk they should approach. It was their decision. We just gave them a list with the common known risk factors, and they decided on their own, very best knowing, because they know their clients best. They know where they, if you are situated in a train station, maybe you have other clients than when you're situated in a rural area. They decided 2 risk groups they wanted to approach. Then they had to think about a strategy, an individual strategy they were able to provide in their pharmacy, use of best formulations, and that's the thing that you need to realize, that in a pharmacy you have several different levels of healthcare providers, and they also need to be involved and they need to be trained. We were then informing the possible patient or client what is the offer, what's able now in the pharmacy for this screening procedure, why he is asked to be involved in this screening. We were carrying out a test. This was a salvation test, the Aura Quick, which leads to a signal. It's not a diagnostic, an ending diagnostic tool. It's just a signal, and we will refer the patients then afterwards to the physician. So we then talked also, during the test was ongoing, we were talking about possible consequences, and also the possibility to come again in half a year, in a year, to do the screen again if there were situations for at risk. And we also thought about documentation, so that the healthcare provider that is next in the care level will get already the information we provide now with the screening, and also for the patient that he knows what was tested now on him. And we offered a follow-up. Also when there was a positive signal, we were interested, is he now in the care system integrated? So has he had the appointment with the general physician or the specialist so that he gets the treatment? Because so far we cannot start the therapy in the pharmacy. They need to go and see the physician or the specialist their own. Or in a negative signal, if a negative signal was the result, so that he was offered a follow-up if he wanted in a few months to a year. And we provide this service in a counseling room. I'm not familiar if you have already been in a counseling room in a pharmacy, because normally it is, as I look into the audience, it's a young population sitting in here, and normally you're healthy people, so you see a pharmacy like mine here from this point of view. So this just, there are corners where you can get stuff, and there are some employees that will help you in the discussion. But we also offer a counseling room where we can sit, where we can talk, where we can do a vaccination, or in this case, a screening program. So this is how our possibilities look like. This is very important to know. If you're going to discuss screening programs in pharmacies, it should be a standard that a pharmacy has a counseling room. So what happened? We invited pharmacies, and we invited them during COVID. So the conceptualization and carrying out was in the year 2021. You remember there were some other workloads to do. So we invited 36, and they started 25. So we have a dropout rate of 31%. We were active in all 3 regions of Switzerland. Well, there are 4 regions, but in 3 different regions. There's the German-speaking part, the French-speaking part, and the Italian-speaking part of Switzerland. We approached more than 400 patients and screened 145. So number needed to approach was 3, unless you have one who gets involved in the screening. And we were able to positively identify 8 patients out of 145. So its number needed to screen was 18, and prevalence rate was 5.5 compared to a general population of 0.7 percentages. So for us, that was quite a success. We also were interested in the evaluation of the implementation process of this service, because we're talking now maybe pharmacies should be involved in this screening program. We are not yet, because this study was performed as a maybe it works idea in Switzerland. But now, if you're going further, if you're looking out for a how do you say that in English? For a task that is provided by the government, then we really should be able to say yes, they can, the pharmacists can. And I'm not sure if you can read it more or less. It was not a big thing for the pharmacies. As long as they were trained, they realized that they can quickly learn to provide the test. They also thought, well, it's a good thing if pharmacies are involved in the screening tool, in the screening programs. And as several risk populations are approaching pharmacies regularly, they are already involved with the stuff. So there is a relationship that can help to involve patients in these screening programs. And to continuation of the service, well, we have here a dropout of about 20%. I think it's normal, but still the most pharmacies would offer the service on a regular basis. Facilitators and barriers. The tests were offered free to the patient and free to the pharmacies as well. So they had no expenses. They got remunerated for the service. They had a kickback if they involve a patient. And what also was facilitation was a training and a new service. So they were motivated to have new things to do. Also during COVID, you got a little bit, well, it was a time, you all know that in pharmacies there was a lot of work with this testing, and it got boring, and we offered them a new service, new motivation. The barriers, I'm not surprised that they had other interactions with the clients, and maybe their reaction was not always a good one. The general workload is always an argument against everything which is new. But I thought I didn't see a lot of barriers. I saw a lot of facilitators. Limitations for us. Now, what we didn't do, or we had some moderate response rate for the evaluation questionnaires. Also, I think it's an issue of Corona. We had no interest for a focus group that we offered to provide in order to discuss topics of this that popped up with this program. And well, the dropouts of the pharmacies I already mentioned. However, we demonstrate that there is not a big challenge to motivate pharmacies in order to involve them in a screening program. And what we also learned is that we really need to focus on the approach of the patient or the client, on which words are used, and probably there we need help from other health professionals, how to approach patient at risk in a proper way. And what was the idea was now to discuss this this possibility with you or with other healthcare professionals, and you will hear about the success of our program later on when Andrea Bregenzer will talk to you with a follow-up program that she is leading in the Kantonsspital Aarau, where she, as an infectiologist, works together with pharmacies where they can start the treatment in the pharmacy directly. And well, it was once a dream, from testing to treatment. What I show you now will probably Mr. Dillon discuss later on, that the pharmacist initiated therapy were more successfully started and ended in their study. They were able to provide this service from the very beginning until the end in the pharmacy, and this might be the goal also to have here in Switzerland with our healthcare program. Many thanks for the support, all pharmacists and patients involved, my former research group, Hepatitis Switzerland, because they were always a good partner for discussions. API Switzerland, I need to point out, because we were supported with an educational grant to provide this training program to the pharmacies, and Andrea Bregenzer for all the discussions we had so far. Thank you.